Can you listen to some heart sounds? All right, and there's a blood pressure cuff over there as well. Put that on her. Technology changes over time, and this is the new onset paradigm shift to the new technology, virtual reality, and this gives them an opportunity to actually get real world experience without having all that stress behind them. Grab that IV, go to the IV pole.
I do feel like you get more security when you're going into an actual clinical setting, and knowing, say like running IVs here will make me more comfortable running an IV in the clinical setting. I hope to do just more sims on it because there's a lot of experience that sometimes you don't get at the hospital because you're working behind a nurse, and this one makes you the nurse. So I feel that's a very big benefit of this.
Especially in the clinical setting. It's stressful. They don't always get to see everything. This gives them that little extra experience, because sometimes when you get in the real world and you're a nurse and you're like, okay, now you have to put a Foley in, and well, I never did that because we never got to see it. This gives them the opportunity to gain that experience. Go ahead, you can touch on her again. Nope, just go right to the trach. There you go. This is probably as realistic as you can get because you can actually feel their pulses, you can interact with them, you can put oxygen on, you can put an IV in, dressing changes. You can do all of that you can do in the hospital. It just gives a little more security. Oh, that's a Yambu bag. Yeah. Check that out. Go ahead. Try Yambu them.
I think for nursing it works a lot because working with a patient could be a little bit anxiety inducing, but now you're working with something virtual, which is still anxiety inducing, but I guess a little bit less.
This is going to be an extreme asset to this institution because we're evolving with the times. We're moving technology. Physicians, surgeons are doing robotics to do surgeries. This is that first step to getting to that. So eventually that's probably gonna, happen here where you're gonna be in a virtual reality.
Appendectomy at age 17, no allergies.
That is very beneficial that you could make a mistake here essentially and you're not making it on per se a real patient. So at the hospital, if you make a mistake on a real patient, there's obviously consequences to that, while here you're in a virtual reality, so it's not as big of a consequence.
When we found out that this was available, the president, the vice president, the dean, everybody was on board. Let's get this in, get these students the best technology they can have to get their overall experience.
It's cool because it sounds like a little vibration.
Right.
Everything has been very good over here at Luzerne. I feel like it was a tough program to get into, but for a good purpose. Especially adding this in, it makes it even more worth your money because you pay to go to school and they're obviously using that money to implement good things into our education.